Hello, I'm Dr. Max Thornsberry. I'm a dairy technical specialist with Milk Specialties Global Animal Nutrition. I want to visit with you today in this video about a veterinary feed directive, a VFD as we know it in the field. On January 1, 2017, the FDA put into effect requiring that all veterinary medications put in feed be under the direct supervision of a licensed practicing veterinarian. Now that was something new for my profession because prior to that time we had nothing to do with the antibiotics that went in feed. I want to tell consumers here that there are no antibiotics in the meat that you consume. Although we do use these medications, they are strictly used for therapeutic purposes. In other words, we treat animals with them, they are withdrawn, and nothing goes to slaughter before it should. Antibiotic in meats is zero in the United States. This product is tested repeatedly, and because it's under the direct supervision of a veterinarian now, we know for sure, absolutely 100%, that we can prevent the misuse of these antibiotics. Now, one of the reasons that the FDA put this into effect was a concept called One Health. One Health means that all antibiotics, whether they're in veterinary medicine or human medicine or dental medicine, are under the umbrella of One Health. These antibiotics are similar. They are used across species lines. This VFD procedure was put in place to protect the integrity of these antibiotics so that they would work when they are needed. I'll give you an example. This is ciprofloxacin. This is the exact same antibiotic class as we find in Vetral. As a matter of fact, the antibiotic that is in Vetral, which we use to treat swine and cattle for respiratory infection caused by a bacteria, very important medication for veterinary medicine, it is converted when it moves through the liver. It's absorbed out wherever we put it. It circulates through the liver. The liver converts it into this antibiotic, ciprofloxacin. And you can see the significance if we misuse that antibiotic, or it's not under the direct supervision of a veterinarian, then it would be the potential that your grandchild have an ear infection, a respiratory infection, someone pick up typhoid fever, which is a salmonella infection. That antibiotic would not work. Because in reality, much of this antibiotic resistance is a survival of the fittest. If we use the same antibiotic, we misuse it, use it for many years, all the bacteria that we use it on that are sensitive get killed out, and what's left are ones it doesn't have any impact on. All of a sudden they go from a very minuscule part of the population in the bacteria world to a much greater and greater and greater percentage of that population. Now the antibiotic doesn't work when we need it. This is an antibiotic that we do not use in veterinary medicine very much. We do use it in calves. We prescribe it. We use it to treat E. coli infection, salmonella infection in baby calves. That's the only place it's allowed to be used. It is the same exact antibiotic that a doctor would prescribe to treat a urinary tract infection. If this medication is misused, when he writes a prescription to the pharmacist, you go in and pick up this medication for a urinary tract infection, and it doesn't work. Now you begin to understand the concept of One Health. This is a very important antibiotic today. This is the antibiotic doxycycline. It is a synthetic tetracycline, just exactly in the same class as this medication called oxytetracycline. This one is made by a fungus. This one is chemically manufactured, but they're in the same class. This is used to treat malaria, used to treat Rocky Mountain spotted fever, used to treat brucellosis infections. I could go on and on. We cannot misuse this antibiotic and expect this one to be available when our physician prescribes it for a very significant and important disease. So One Health means all antibiotics in the veterinary profession, whether it be veterinary, human, or dental, are all under one umbrella, and that's the reason why the Veterinary Feed Directive was put into effect. In Europe, they were not allowed to use feed-grade antibiotics, weren't allowed to treat an animal through the feed, and their use of injectable antibiotics, according to Dr. Hurd, who spent some time there from Iowa State, quadrupled, meaning they're using very important injectable antibiotics that are identical to human antibiotics because they're not allowing some of these first-generation antibiotics to be used in the feed. So, a veterinary feed directive puts all use of antibiotics into a therapeutic row. No more daily gain, fee efficiency, no more low levels. It's either a therapeutic level or nothing. It's for a specified period of time at a specified dose for a specified weight. I write my VFDs utilizing Global VetLink. It produces an electronic VFD, which has my signature on it. It gives you all the directions. It has all the many things required to be on a VFD. I'll not go into all of them, but it's multiple things, 14 to 18 different things that are on this VFD. This is one for using chlorotetracycline in a mineral mix on a daily basis to prevent anaplasmosis in those states of us south of the Mason-Dixon line where we have anaplasm that's endemic, spread by horseflies, ticks, midges, mosquitoes, anything that sucks blood. This VFD is for using aureomycin or chlorotetracycline, which was discovered in a corn plot experiment plot in front of the veterinary school at the University of Missouri and Columbia, Missouri in 1947. Most of these first-generation antibiotics are produced by fungi, and they make the antibiotic in order to prevent bacteria from competing with them for a source of organic matter. This one is for a gram of CTC per 100 pounds of body weight daily for 5 days. That's a treatment dose to deal with an outbreak of respiratory disease in feedlot cattle, and it's a very effective. It keeps us from having to use something like Batril or some other type of antibiotic that's much closer to a human-grade antibiotic that your physician might want to use. Here's another one, 350 milligrams of CTC a day. This is a dosage to prevent respiratory disease. We don't like to use the word prevent. It is still a therapeutic dose. It's a 0.5 milligram per pound of body weight, but it helps us deal with bad weather conditions that would cause calves to break with a respiratory disease or certain types of intestinal infection. This one is Oxyted and neomycin for milk replacer. This one has a 5-day withdrawal. All of these others have no withdrawal, meaning it doesn't get into the meat at all. This one has a 5-day withdrawal, but it never leaves the digestive tract. But they want to make sure that this antibiotic isn't contaminating the skin of the animal or something that might expose humans to it. So once we complete our treatment regimen, we must wait 5 days to slaughter that animal. These do not leave the digestive tract. In other words, they don't go in the blood, they don't get in the meat, they just stay where the bacteria might be impacting the calf. Now, we keep a copy of this for 2 years. I have here an audit from the FDA where I've been audited twice by the Missouri Feed and Seed Division, who's been contracted by the FDA to audit veterinarians. In other words, if I write a VFD and the Feed and Seed Division goes to a feed mill and finds the VFD, they will pick it out, they'll bring it to me, they'll make sure I actually wrote it, that I wrote it correctly, that I matched up all those 14 to 18 things that need to be on there, that I have a copy in my files, the feed mill has a copy in his files, and I made exact efforts to make sure that the producer had a copy in his files. We all maintain that copy for 2 years. So the auditing has already begun. This should not be taken lightly. The FDA takes this very seriously. They intend that when your doctor goes in to get ciprofloxacin and give it to your grandchild or your own child that has an ear infection or pneumonia, they intend for this antibiotic to work. And for it to work, we must follow the guidance and directive of how we use it in veterinary medicine. Now, we could get very complicated in the concept of these VFDs, and it's not my purpose here today to tell you what a type A, B, and C feed is, a category 1 or a category 2. I have a book that I've written called the Dairy Calf Production Protocol, 8th edition, and on this page, which is 111, I have a 2.5-page write-up of VFD, about a VFD, that will tell you everything you want to know. Puts it down in concise, very summarized information, and you can visit with your veterinarian. If you happen to have a 7th edition of this book. It's on page 126. Same paper, same article, same information. If you do not have a copy of this protocol book, it covers just about everything you could think about for calves from birth to 300 pounds, heifers and steers, both replacement heifers and steer calves. Call up your feed distributor and tell them you want one, and I'll make sure you get a copy. Something you ought to have in your library. It's got a table of contents that you can look up about any subject, go to it quickly, written in plain English without too much Latin, and I think you'd find it very helpful in your management system. Let's talk just a few minutes about the difference between a Category 1 and a Category 2. A Category 1 antibiotic is one that does not require withdrawal. Through an authorization of distribution, if you're making feed up for a large feedlot or you're making feed up for a big swine operation, poultry operation, you may keep those antibiotics in your inventory and use them with the authorization of a VFD. You cannot use them to make a feed unless you have a VFD to make it, and you have to keep the inventory. Not many producers I work with have an authorization of distribution because they don't really want the headache of keeping all this inventory. A type 2 veterinary antibiotic in the feed is one that has a withdrawal. For instance, oxytet and neomycin is a type 2 drug because it has a 5-day withdrawal. It is the only antibiotic, oxytetracycline, neomycin, approved to put in a milk replacer. It stays in the intestine. It is bound up in the intestine with calcium. No other antibiotic is cleared for that purpose. Now, you can treat the drinking water of animals with various antibiotics. That requires a prescription. That is not a VFD because it's not feed. Your veterinarian must write you a prescription. Remember, when a calf drinks water, eats hay, feed, it goes into the first stomach. And that antibiotic is absorbed out of the stomach into the bloodstream if it's absorbable, and then distributed to the tissues where it's needed. When you put something in a milk replacer, it bypasses all the stomachs, the first 3 stomachs, and goes directly to the 4th stomach because milk causes the esophageal groove to close at the end of the esophagus, and it shunts everything down. Now, when it gets into that 4th stomach, it is a very acid environment. There are very few antibiotics that will survive that environment. And so honor what the FDA has done. Do not use any other antibiotic except oxytetracycline and neomycin in a milk replacer. We have been writing VFDs for an antibiotic called Palmitil. You might know the antibiotic as Micatil, which is an injectable. Palmitil is an oral form of that medication, and we've probably been writing VFDs, I don't really know how many years, maybe 10 years. But now every antibiotic that would go in feed and only for a therapeutic purpose requires a veterinary feed directive. I want to talk with you a little bit about AS700. AS700 is cleared to feed 350 milligrams of chlortetracycline and 350 milligrams of sulfamethazine to an animal per day. Sulfamethazine has an impact on respiratory disease, but primarily is utilized to control coccidiosis. And of course, chlortetracycline is an antibiotic that inhibits the growth of bacteria that might cause pneumonia. You cannot feed that to any replacement dairy heifer or lactating dairy cow. You can feed it to dairy steers. You could feed it to a bucket calf when it's in transition. But remember, the FDA has removed any sulfa, period, from our use in dairy replacement heifers and lactating dairy cows, including this one. You need to make sure that your veterinarian is aware of that and that you don't use an antibiotic inappropriately. Well, that's about all I want to say about VFDs. I hope you've picked up some very practical information. To get into the nuts and bolts of this, A, B, and C, and 1 and 2, and all of that, read the article that's in this book. It specifies it very clearly. Do not use an antibiotic. If you've got some sitting back there, I had a guy tell me the other day, he said, well, I knew my VFD was due, But I had about 2 or 3 months left, and so I just kept on feeding. Well, that's a violation of the law. You must have a VFD to feed it. I don't care if you got a tractor trailer truckload sitting in the back of the barn. You cannot feed it without a VFD, and a VFD has a limited time. It lasts for 6 months. So be very cautious. Let's all of us, every one of us, take this seriously. This One Health, let me tell you, I have a granddaughter right now taking this antibiotic that contracted a very significant disease, somewhat like Rocky Mountain spotted fever. Spent 4 or 5 days in the hospital, high fevers, rashes. This is the antibiotic that she's on, and this is the antibiotic that saved her life. We cannot misuse these antibiotics because the day may come when you or one of your grandkids or your child needs to fall under this umbrella of One Health. If you have any questions about a VFD, all of my contact information is in the back page of this book, and I'm one of the few veterinarians that actually return their phone calls. Thank you very much.